Emotions associated with pain. Welcome to this talk. In our previous discussions, we examined how different types of sensations and triggers can lead to emotional responses, and how awareness can help us recognize these processes before they become overwhelming. In this talk, we will focus specifically on emotions associated with pain. Pain is a very familiar experience. At some point, almost everyone experiences physical discomfort or pain, but the physical sensation itself is only one part of the experience. The way the mind responds to that sensation can sometimes make the experience much more difficult. A small pain may produce irritation, fear, anxiety, or an urge to immediately escape from the situation. In other circumstances, a stronger pain may be tolerated quite calmly. This raises an important question. Why does pain sometimes trigger such a strong emotional response? To understand this, let us first look at the mechanism involved. Triggering based on pain sensation operates on a very simple mechanism. The pain sensation occurring at the moment, together with its rate of change, is used to predict the chance of exceeding an allowed threshold. When there is a danger of exceeding that threshold, an emotional response will be triggered. For example, if you experience a mild discomfort that is remaining stable, there may be little emotional reaction. But if the sensation is rapidly becoming stronger, the mind may predict that it could soon exceed a tolerable level. This prediction itself can contribute to an emotional response. The normal advice given to minimize the harmful effects of such emotions is to use patience. Just like other skills, the application of patience is associated with the development of the skill. Therefore, to use this method, one should develop patience in a systematic manner and also learn to apply it when required. Knowing that we should be patient is not necessarily enough. Just as we need practice to develop any other skill, we need practice to remain patient when an unpleasant sensation is actually present. Detection of the pain sensation before it becomes powerful and forceful enough to generate reactions is a skill that can be developed with awareness meditation. However, the technique is different from the previous methods that we discussed because awareness should be directed towards sensation rather than towards the body. Actually, while attempting to develop awareness of the body, you may feel pleasant sensations as the mind and body become calm. Although it is perfectly correct to enjoy such sensations, you should not shift your attention to the sensation while attempting to develop awareness of the body. The purpose at that stage is to develop awareness of the body. However, when awareness of the body is reasonably developed and the pleasant sensation is somewhat stable, you can shift your attention to the sensation through a conscious act. This will start a new meditation technique, which will help you to develop awareness of sensations. This shift of attention should therefore be deliberate. For example, while developing awareness of the body, you may experience feelings of lightness, warmth, relaxation, or comfort. You can recognize these sensations, but continue developing awareness of the body. Later, when the appropriate level of body awareness has been developed, you can consciously shift your attention toward the sensation itself. Practice of this technique will provide the skill of detecting not only pleasant sensations, but also unpleasant sensations. With more practice, you will learn to differentiate sensations related to the body from sensations related to the mind, as they have different properties. This distinction can be useful when dealing with pain. Sometimes there is a physical sensation, and then the mind adds fear, anticipation, memories, or other thoughts to that experience. Being able to recognize the physical sensation separately from the mental response can therefore become an important skill. Detection of the pain sensation before it becomes strong is a reasonable achievement. This skill will work at a secondary level and provide the required information to your mind, which is likely to be engaged in some other activity. For example, you may be walking, eating, reading, working, or having a conversation. Your main attention may be engaged in that activity, while the developed awareness can still detect the emerging pain sensation and provide the necessary information to the mind. However, this skill itself is not sufficient to disable the triggering mechanism unless it is supported by the skill of being patient. This brings us to an important question.